I don't think I want to come to UK to work.
Did I discourage you? It's not that bad.
You have broken my heart.
Oh, it's not that bad. It's not that bad. You have to be very determined and not love money to work in the NHS. If you want to be broke, go to the NHS. I'm joking. It's not that bad.
That's how I see it. Tell me more. Hello guys, welcome back to my channel again. You know, every day I bring a young achiever here, somebody who has something unique in their field to share. And of late, I've been playing in UK's background. I've been playing in your backyard. I've been going and interviewing people from UK, and I have another sister here from Nigeria who lives and works in UK, and I follow YouTubers, so I'm sure most of you know the face, Gloria. And if you haven't subscribed to her channel, please go and subscribe to her channel. We are all sharing this information to help you make a decision in relocating. So subscribe so that you don't miss any important videos. Today we're talking basically about life in general as a nurse in UK, what informed her migration, and what advice she has for people like us who are yet to make the decision. So thank you very much for honoring my invitation, and thanks for coming onto my channel, Gloria. And before I forget, I'm still the lead consultant for USRN Pathway Consult, UPC for short. If you're a general nurse, midwife, psychiatry nurse who wants to work in USA and don't know how to start, where to start from, just find me at www.usrnpathwayconsult.com, and then we can talk about your process and your USA dream. Okay, Gloria, over to you. Please introduce yourself. I've spoken a lot.
Thank you for having me. Well done for all you do. I follow you. I've watched your videos and they've been beneficial. Thank you for having me. My name is Gloria. I have a YouTube channel. I'm a Nigerian UK-based registered nurse residing in Scotland, most beautiful part of the UK. And yes, I'm happy to share and encourage you. If I can do it, you can do it.
Nice. Thank you very much for honoring my invitation once more. So do you want to walk me through your nursing journey? What even informed your decision to become a nurse back in Nigeria?
So my journey has been, I don't know, maybe easy, but I can't say it's easy, but it's something I've enjoyed. It's like a process. It's like my life. I think when I was about 7, I can't remember, but when I was about 7, I went to the hospital to visit someone, and they had this white uniform with a nightingale cap. And I remember telling my mom I was going to be a nurse. So even in my primary school, you know, when we do what do you call the activity? Career days. I remember they gave me some other profession, and I cried, went home. I cried to the extent my mom had to follow me back to school to beg my teacher that I want to be a nurse, because I thought whatever you asked that day was going to be what you become. And then I was a nurse. They had paper cap, and I'd always wanted to be a nurse. Although when I grew up and after secondary school, my mom wanted me to do agric accounts, and then I started pursuing admission. Luckily for me, I couldn't get admission. And my mom was like, do you remember you've always wanted to be a nurse? Do you want to try? And I tried, but then I was too late for the admission for the year. I had to wait for another year. And here I am. I became a registered nurse in 2010. And I'm still a nurse. I've never done any other thing apart from nursing. I practiced in Nigeria for a few years before I then went to School of Nephrology to do nephrology nursing, just like dialysis nursing, in National Hospital Abuja. In 2016, I then became a renal nurse. I did renal nursing for a few years in Nigeria before I moved to Dubai, where I practiced in a private hospital for a few years before I migrated to the UK. Started in a care home, 2 care homes, from one care home to another. And this year, January, I came to the NHS, and I'm currently practicing as a renal nurse, dialysis nurse in the UK. So that's my journey.
Wow. I'm sorry. Went to Dubai?
Yes.
Wow. And you work in Dubai as an RN?
Yes.
How was the experience like in Dubai?
Beautiful. Very, very beautiful. Very, coming from Africa, that was my first country I ever flew to. So it was like, wow. It was so beautiful. But because I have young children, at the time, my children, I think my second son was about 4 years. I had my last daughter in Dubai actually, and it's just not for children. So it's too fast, it's too artificial, it's expensive, it's just too much, like too much for raising children. So that was when the first day I got to Dubai was the day I knew I was never going to stay in Dubai, and I had to start my process to the UK, and I've been in the UK for just over 3 years now.
Wow. And you lived in Dubai for how many years?
2 years and a half, just over 2. I went to Dubai beginning of 2017.
Wow. Wow. That's impressive. They always say travel and see. And so you go beyond your house or your country, you don't know there's something else where. And it actually broadens your horizon, it opens up your mind, you become a well-shaped person. So wow,
Yes.
I have a lot of experience. Yes, that would never be taken away from you for sure. So YouTubing, what happened? How did you get onto this YouTube platform of ours? What informed your decision to share your journey?
Okay, so personally, I'm not a quiet person. Depends on if I get along with you. Like if you meet me, you feel like, oh, she's so quiet. But when you get to know me, I'm a talkative.
That's me too.
Yes. So I gotta get comfy around. And when I was younger, my school, even in nursing school, they knew me as a slim talkative. I was so talkative. Although now I'm more reserved, with age and maturity. So when I moved to the UK, the only person then that was doing a YouTube video, I always acknowledge her, Nancy Wangui. She's from, is it Kenya?
Yeah.
Kenya. She was the only one I knew at the time that was uploading videos about the UK. And I was always looking forward to watching her video. I was always expecting, like, I always want to see her next video because she was the only information I had. I got to the UK and I thought, how will people know that you can do this? How will people know about traveling abroad? And that was how I started with one small phone, crazy video, crazy lighting, crazy audio. I just did something. And that was what brought about my journey. I just wanted to share. If I go and apply for, let's say, my ATM, I come back and I explain, this is what I did. When I got on the bus, this was what I did. And that was how my journey started. And we're here.
Yes, these videos, we sit in our houses doing something and it's changing lives somewhere. Recently, somebody got a job offer and can't keep saying thank you to me. I didn't know what I was doing. I was just doing something. And she said, because of you, I watched your videos, I wrote and clicked, and I'm in America. I was like, wow.
That's the best thing anybody can tell you. Like, when they come to your inbox and they say, Gloria, because of you, my family is in the UK and my family back home, like, who can pay you for that? I just like, wow,
it's
priceless.
So sweet. It's fulfilling, it's so surreal, it's the highlight of everything. You can't use any adjective. Priceless, surreal, highlights. It's just fulfilling.
That's it.
We can't, sometimes we feel like we want to quit because most of you don't share our videos, most of you don't subscribe. But people like that forge us on not to quit. Yes. So then you figured out the process and you moved to UK. Where did you start from and why the change? Why did you move to NHS? You were in the care home, and what's the difference?
So yes, when I when I was in Dubai, I actually came across moving to the UK coincidentally because I was working with a Filipino nurse, a Filipino guy who at the time was processing coming to the UK. And I speak to you, he's in the Philippines right now. I think he was just an angel because we were working together and each time he's like trying to study for IELTS. I'm like, what are you up to? His name is Edward. And he's like, he's studying for IELTS. You don't know you can do it, Gloria. Maybe you should give it a try. I'm like, right. Because then I wanted Canada. And you know how Canada is. They say you pay this, is that, you wait for many years. I'm like, okay. So let's try the UK. And that was how I started. So I'll get information. I started trying to take my English exams. I failed English exam, writing in particular, 5 good times. I passed. Luckily for me, OET now became accepted in the UK. So that was when I attempted OET and then I passed. And that was how. So my journey has been, even at the time I was pregnant, I'm like, I'm not going, forget about it. It's not my calling. Each time I may have like 8 in speaking, but writing will remain with 0.5. And you have to have 7 at the time. So I couldn't. I kept going and going until I passed anyway. And then the agent I had then, MMA Recruitment, they only had a contract with care homes. So the only choice I had then, I know there were no information. So the only options I had was just the care home. And they said, look, we've got spaces in Scotland, England, but none in Northern Ireland. And I wanted to go to Northern Ireland. So they said they didn't have any care home in Northern Ireland. My only choice was to come to Scotland, which was a care home. So I started in the care home. I made a video about the care home, like I call it co-workers from hell, toxic environment. Coming from where I was coming from, no UK experience, your humility, when your humble spirit of when they say, "Oh, well done, Gloria," you say, "No, it's not me, it's God." That type of humbling spirit. Not unknown to me that in the UK, if you've done something, you have to show that you've done it. You have to show that you know your stuff. So I was a bit naive, so they took advantage of me. I worked there for a year and about 3 months. I had to run because it was affecting my it was affecting my mental health. If I go to work, before I come out from my car, I'm like, God help me. I was having anxiety. My children knew I was not happy. I had to leave. Luckily for me, there was one care home very close to my house, just 6 minutes walk away from my house. I'm like, so why the stress? And I had to travel 25 minutes drive to that work. So why the stress? So I had to switch. I switched to that job. Lovely place. The manager is a Zimbabwean woman, black like me. So there was no racism. I was, local champion with my experience from the previous care home. I came knowing what I was doing. I know when you come to the UK, you come as a carer, like a band 4. So you're coming in, you're not a nurse, because if not, you don't have your PIN before you do your OSCE, yeah? You don't have your PIN, so you're working as a care assistant. They teach you how to change pad, you're doing the feeding. So my transition to becoming a nurse in that first care home was a bit of, how come? When did you come here that you want to come become our boss? So I struggled. So when I moved to my next care home, I went there as a registered nurse. I already knew my stuff. I transitioned well. I became the local champion. I was doing nurse in charge things and all. But then this colleague of mine was like, "Gloria, you're too young to be in a care home. If you ever decide or consider moving to the NHS in the future, so just do it now, because you will regret not doing it. You're a renal nurse, apply, get more skills, and you can retire to a care home." Nothing against the care homes, but that was what, and I always love nephrology. I love dialysis. I love the machine, So I got the opportunity, took my interview, passed. They wanted me, like they were desperate to even have me. And that was how I transitioned to the NHS.
Wow. Wow, what a journey. I did not know that if you come in as a foreigner, you are an automatic carer until you transition. Everybody till date?
Yes, just because the exam you take in Nigeria is the person view one. You do the CBT computer-based test. You do your English exam. You get your certificates to come, like invitation to come and take your OSCE. So once you're coming to the country, and although you have to take your OSCE, the first attempt within the first 3 months of getting into the UK, you have to go for trainings at least 1 or 2 months, or at least 6 weeks, to know because it's a practical. You go to nursing council, they have centers. You go there, they'll set stations, OSCE stations for you, and you go and you do the practical. So you have to practice, study, learn. So that period, you're not a nurse. You can't you shouldn't be giving medication. You shouldn't be a nurse. So you wear the same uniform or something similar to what the carers are wearing, and that's what you are. So you're like a band 4. Okay, so until you have your OSCE, you pass it, and then you get a PIN. So once you get your PIN, that's when you become a registered nurse, and that is when you can then begin to practice. And you're starting as a band 5. So you don't become a nurse until you've passed your OSCE here in the UK.
Okay, and then you become band 5.
Then you become a band 5, and then you're a nurse. You can then do nursing things. But before then, you're not a nurse.
Okay, thanks for clarifying that. So you mentioned you came through an agency, but you were able to change your care home twice. Is that something possible?
Yeah. So once you come to an agency, it doesn't matter. You're not attached to the agents. You don't pay them a dime. You can do it yourself from your home, or you can do it through the agents. In the past, when I came to the UK, agents will go to countries, the Philippines, Africa. They will encourage nurses, help you through the process and arrange interview between you and your employer. But you don't pay them. The employers pay them. They have, I don't know how they do it. They pay them. So that's it. Once you get the job, they've attached you to an employer. That's them. That's their business done with you. They can follow up to say, how are you doing? Maybe 1 year later, but you don't owe them nothing. You have no business with them. You now have business with your employer with your contract. So your contract can say you're going to pay so amount back. If you work 1 year, you pay maybe 50%. If you work 2 years, you pay 70%. Or if you don't work, so they will give you your condition. And some employer may say, no, it's fine, you don't need to pay us. So my employer at the time said, if I don't work 3 years, because it was a 3-year contract, I'll have to pay them back everything they spent for the transport, for the flights, for the visa, for whatever. But that was nothing compared to my own peace of mind. So I had to leave, notwithstanding the conditions. But you're not attached. No, you can leave. You can move whenever you want, as long as you're ready to meet the terms of your contract of maybe paying them back or not paying them back.
Wow. So the reverse applies to US. The recruiter does all that for you, and then they bring you, and some of them you are bonded to them. So you are the nurse for that agency. You are not the nurse for that hospital. But some of them to do all that for you and bring you, and you do direct hire. So it's a little bit similar, at the same time different. Some of the recruiters, the hospital pays them and say, find me 100 nurses. And they do that so that you don't pay them anything because they've been paid by the hospital. Some of them today are doing their own thing and they are supplying nurses to the facilities. So some of them you have to pay token and all. Nice, I see. So nursing salary in NHS. Before then, you are now with NHS and you are practicing as a dialysis nurse, correct?
Yes.
Okay. And how has that experience been? I know this is what you love and you've always wanted to do it. How has it been so far?
It's been wonderful. Very, very nice. Like, it's a thing of, I've been in a care home for over 2 years, and then coming back to dialysis, I feel like crying. I'm like, oh my God, like, because I didn't know I could do it easily. I thought you have to go to school, but unlike indeed, you don't need to go to school. You learn on the job. In fact, people who finish from school can just walk into the dialysis unit and they learn. So it was no big deal as much as I thought. So when I had the opportunity, I appreciated it. I felt lucky. And then on the job, you learn a lot. In fact, compared to nephrology or dialysis back home, we're just playing. We are just playing. It's sad. It's very, very sad. It's sad because it's like, wow, it's different. You learn a lot, but I'm somebody that don't get satisfied on time. So I'm already looking about again, shopping for all that specialty. But at the end of the day, it's fun. Like I love the people I work with. You see the same patients every week. Every week. If they like you, good. If they don't like you, that's you, because you have to deal with them for the rest of their life or the rest of your career. But it's been fun.
Yes, I know it looked fine. At some point, I was also looking out to see what else I can do. So, and I had to take patients to dialysis. Like I take them from my floor and take them downstairs.
Okay.
And after 4 hours, they give me a call. Your patient is ready.
Yes.
I'm eager to go. So I go with the CNA, then we go bring the patient back. And I think this is cool. The patient is hooked up. Sometimes they bring the machine to the bedside. We have bedside dialysis. We go to the
yes.
Oh, so I'm like, this is cool. I sit here, punch the machines. Every dialysis is going on. I'm checking on the patient and all. But I had a patient of mine who coded on the dialysis machine and they had to call me to come down and all. So I'm like, it's not that safe. Anything can happen to the patient there.
Any minute, like you can have somebody
always drops. Yeah.
Like you can have someone on dialysis in 2 minutes and they are gone, and you have to do resuscitation, CRP, you have to oxygen, you have to discontinue that. You don't. You have to be out a lot.
Yeah, it's not just easy like that. You have
No.
Yeah. So now we know that even if you have a specialty from Africa or outside the UK and you want to use it to work, it's possible to use it to work without necessarily going to school.
No, it's possible. Maybe when you're on the job, like I see you, they can then say they will train you. You can then go back to school and learn more skill, but you can start without having any clue, and you learn on the job.
Okay, so I see most YouTubers. Shout out to Nanelle, a fellow sister from Ghana, and I've been on her channel twice. I see most YouTubers comparing care home and NHS salary. Tell me a little bit about what's going on there and which one is better.
So you have to be very determined and not love money to work in the NHS. If you want to be broke, go to the NHS. I'm joking, it's not that bad.
That's how I say it. Tell me more.
It's so sad because we are planning a strike action because it's sad.
Is that bad?
Yeah. Somebody who is a band 5 in the NHS, wherever you are, except you're in London that you get, because London is more expensive, you start from 13 point something pound per hour. Max is not even up to 14 pound per hour.
That's an
And
RN.
per hour for a registered nurse, no matter where you are.
If an RN is taking 13.5, what about a carer?
Carers are like within 10, 11 pound. And if a band 4 and a band 5 salary is 60p, it's less than a pound. That's the only difference. It's sad. Like the NHS is screwed. They don't know what they are doing. They are clueless. It's not funny because we are like a joke. If you work in RD is one of the shops like what do you have in the US?
We have Aldi. We have Aldi.
You have RD. If I work in RD, I may be making 11, 12 pound per hour.
More than almost, a carer.
just almost like a nurse, just like 1 or 2 pound less than a registered nurse with all that responsibility. So it's sad. So your salary within a year now is even a bit higher. It was lower. Before it's about 24,000 a year. But now it's about 26,000 a year. And then every year or two, they will add maybe 2,000, I don't know. And you get to the top of your band. If you cannot get to a band 6 is a different role. You're now the nurse in charge. You're the one doing the off duties. You're the one telling people what to do. If you can't get that band, you're going to remain in a band 6 for 50 years, for 20 years to remain in the same position. So you have to then try to work your way to that band 6. Then you get to the top of your band, you're stuck there, you cannot go further. Or until you get to a band 8, like I don't know. Somebody who is in, let's say, Canada, the starting salary of a nurse in Canada is the salary of a band 8A, which is like your matron. That is only one in the whole unit. That's the salary. That's how bad it is. So the NHS is terrible for payment. Unlike the care home. In the care home, my last job, I was on 16.70 something per hour.
As RN?
As an RN.
Why would somebody leave a care home and go to NHS? What was your reason?
Just determination. In fact, my first care home, I was earning 18 pound. My first care home, 18 pound per hour. And they increased it when I left. So the second one was 16. So I left the care home because I was unhappy. So they want to. Then I left the second one because of career growth. You see, at the end of the day, life is not all about money. I can be earning even 50 pound per hour in a job that I don't enjoy doing.
I'm happy. Mm-hmm.
And I'm unhappy. If I go to work today and I know that I'm going to earn just, let's say, 13 pound per hour, but I'm like, this is a job like I love to do. I love it. Like I'm in love with it. At the end of the day, it's not all about money. Although money is very important, but I don't know. You get to a point in your life. I'm still very young. I'm just 12 years being a nurse. I think I still have a lot to learn than staying in a care home where I already knew. In fact, as I am, my last care home, I know the medications. I know every resident. I know what they eat in the morning. I know what they eat in the afternoon. I know everything, and I'm not adding much value personally to myself. Although you still go for training and all, but at the end of the day, I'm not challenged. I like challenges. So that was why I had to leave.
Because of my consult, UPC, I get to speak to people from all walks of life. And the people I speak with most are UK nurses who want to move to US. In a day, I don't get less than 10 UK nurses making inquiry about how to move to USA. So my question to you is, why are nurses leaving UK to USA?
The answer is depend on the individual. I don't know what goes on in people's head. The same way people, in fact, I've seen nurses that also want to leave the US to the UK. You're wondering, why will you want to do that? You see, I've seen nurses want to move from Canada to the UK, and you're wondering why. Like, are you out of your sense? Like, why? But they have
Are
their
you
own
crazy
personal.
or something?
Yeah, are you? I don't want to use the word, but they have their personal experience. But the thing you ask one of them is, the first thing is, when they came to the UK, where was the original destination? Where was the original destination? See, people come to the UK because I'm not saying it's easy, but it's way easy.
Yeah.
It's way easy. Dubai as well is way easy. Dubai is very easy.
Oh.
Then UK is very easy compared to Canada or the US. So when the original intention, where was the original destination? If you ask them, is either the US or Canada, most nurses. But because of the time, the expenses, and the blah blah blah, okay, let's go to the UK, and from UK we'll do our process. So that's one reason. Another reason is the money. We've just spoken about the money. The money is, I know somebody back in Africa will say, oh, you're greedy, £13 per hour. That's like how many thousand naira? But when you consider the cost of living, the rent, the UK is in crisis officially now. The workload in the UK is stressful. Britain, they will give you £1, but they will use £2 out of your blood. They will use you. They don't part away with money unnecessarily. So they will make sure that they use you. When you go to work and you come back, 12.5-hour shift, your legs, your brain, your body, you're exhausted. Like your next off, you're just trying to recover. It's very stressful. Extremely stressful. And another thing is the career growth. So now, even myself, I feel like, so how long can I continue to be a band 5? If in a unit you have just maybe 2 band 6, and how is everybody able to then fight to get to that band 6, where once you're in band 6, you get enemy because you're now the one who tell people what to do. You're like a leader. It's not everybody that wants to be a leader just because, career advancement. So people who don't want such. Someone like me, I don't want to remain a band 5 forever. They don't consider how many years of nursing experience you have. You're just still going to remain like you have. I'm a registered, I have a certificate in nephrology. I had a girl walked into the unit a few months ago, just from school, from uni. She's not been anywhere, no experience, and she's on the same salary, she's the same banding as me. It's annoying. She doesn't know, in fact, she doesn't even know what a dialysis machine is. She doesn't have a clue. And here you are, you're the same, you're getting the same money, you're just the same. So people don't want this. People want more, you see. So those are the reasons why people will leave. And as well as, even let's say, environment, if some people want to change, I don't know. UK right now is not in the best position. Like it's very expensive. There's very expensive, and you're not getting the money. So why not go to the US where, and as well, I like the houses in the US and Canada. They're bigger, they're spacious. I can live because of that. so many reasons why people want to leave the UK.
Wow. The accommodation. I see a lot of YouTubers talk about accommodation. The rooms are small and it's a struggle to get in. Recently, Becca Bay was sharing she slept in her car for 3 days. What is going on with the accommodation? What's going on?
I don't know why, because the UK, see, some of the houses that we have here, they've been built in 1901, 1900, and they're not going to build another one. And it's just the same shape, the same size, because it's a small island. You see, the population is excess. The population is too much for the small island. So we are squashed together. There's no space. There are no houses.
The roads are so small.
Oh, yes. And on that same road, if I show you my road right now, you'll see there's a car parked on the road. It's allowed. Half of the road is car park because there's no car park in their houses. So half of the road is car park, and then you have to, if 2 cars are coming, one will have to wait behind the other car for another. Some roads are like that, except it's a double carriageway. So there's so many reasons why, although if you don't have any other choice, if Africa was your choice, of course you want to come to the UK. But then when you get to the UK, you're like, oh, there are still better places you want to go.
Wow.
That's why.
Wow. So did you say somebody fresh from school, that means a UK trained nurse, came in as band 5? What band do they have to come in as, a UK trained nurse?
Band 5, because they did OSCE in the school. They passed before they came. So they're band 5, just as somebody who has, once you pass the OSCE, you're a band 5.
Okay. So salary wise, is a UK trained nurse paid better than a foreigner?
No, that's a
Really?
good thing. No. So if I'm an NHS nurse and I'm in England, you're getting the same amount as I'm getting here in Scotland. You can't bargain. No, you just get a job, you're band 5, that's you. Nobody's bargaining with salary with you. In fact, I didn't even know my salary. I didn't know my exact salary until I received my first paycheck. Because nobody's going to even bargain and say you're on so per hour. No, you can just see a year, 20 something thousand per year. That's it. So
Wow.
everybody is the same banding, the same payments in the whole NHS.
Wow.
Except you're in England, where because it's more expensive, you get London, you get the London living allowance. I think 20% more or something, because houses are extremely expensive there. Every other person is on the same salary, wherever you're from, Ghana, wherever, you're the same.
Wow. Wow. So everybody's salary is the public knowledge, unlike
It is.
USA, where two nurses trained the same day, hired the same day, are earning different things, and you can bargain how much you are paid. Because if you don't want to offer more, somebody's offering 10 times that. So obviously,
Wow.
you're going to lean towards that person.
Yes.
Wow. So, I don't think I want to come to UK to work.
Did I discourage you? It's not that bad.
You have broken my heart.
Ah, it's not that bad. It's not that bad. We're
So,
surviving.
any advice or tips for our people in this application process? What should they be doing? What shouldn't they be doing? Anything at all you want to share with them?
So, if you want to travel abroad, see, like I used to say, my own channel, for instance, my channel is not for, I'm not there to convince people to travel.
Mm-hmm.
My channel is for people who have already made up their mind. That's the level that they are, but they just need a little push. I'm not going to now start to convince you 10 reasons why you must move to the UK. You don't have to. Some people's destiny is not in the UK. So you can stay at home and be happy, even reach out, live a better life than I am living.
Oh, yeah, of course.
So if you've made up your mind that you want to travel abroad, research, make your findings so that you're not being shocked. Because you'll be in shock, I tell you. When you go to these countries, you'll be like, wow. In fact, when I moved from Dubai to the UK and I saw the houses, I was wondering, I'm like, with the jet lag and everything, I'm like, wait, am I in the UK? That UK, am I there? And like, what is this? When I saw the houses, I'm like, is this the so-called UK? That because you'll be in shock. Get ready for changes. Get ready to be educated and re-educated. Like, you have to unlearn and relearn, because it is not the same at all. Be very determined, be very focused, because nobody will hold your hand to pull you to your next stage. You have to be the one who is determined. Nobody is here to baby feed you. You don't have your families there. You have to know why you're here. Be very focused and be determined, and you can do it. Like I said at the beginning, I took exams, just English exam, 5 good times. It's embarrassing sometimes, but at the end of the day, it is determination. Today is a story. Like, I can't even remember what I spent or whatever. It's gone. You have to be determined, and you have to be ready to do your research. Be focused and be ready to learn. Wherever country you come in, either the UK, be ready to learn, be humble yourself, and just be an open book. See how people behave and follow them. And I think the sky is going to be your limit. You can do it. If I can do it, in fact, my story is a bit very rough. Like, I left my children, my husband, my family, moved to Dubai. From there, they joined me. I moved again to the UK. I was in the UK for 7 months without my family, my newborn baby, nothing. And I'm here today, survived. So you can do it. There's no excuse. You don't have any excuse. You can do it. At the end of the day, it's worth it.
I was going to stop you when in the introduction you said my journey was easy. I said there's nobody who has been abroad.
It's not easy. It's not easy.
The fact that you even dress up and go to an embassy and ask for visa is not easy. So anybody you see abroad, it did not fall on their lap. People think Priscilla had it easy. Her husband brought her. I was denied visa once, twice, third time. It took me 8 years to get to America.
Wow.
It's determination. It's not like, oh, husband came for her. She's not. No. He came for me, but I worked hard. I could have given up on the relationship, but it's you have to be determined.
Yes.
So it's impressive that you went through all this, left your newborn baby, went to Dubai and everything. I've enjoyed this conversation. This is one of the like very raw, like truthful, open heart conversation I've had this week. And I really, really want to commend you for gracing
Oh,
my channel. And I know that I'm gonna bring you back to be seeing this face a lot on my channel. I love to talk to people who are knowledgeable in their field. We are proud of your journey and made a salary. American will call it a salary cut. You change your job from it to and then
crazy.
from care home to NHS. Who needs care home to NHS?
Because I'm
But
crazy.
yeah, but sometimes your peace of mind, almost always, your peace of mind is paramount. You can have all the money. You hear billionaires jumping off buildings. So people have the money, they have the fame and all, but they are still miserable. Whatever will give you family time, peace of mind, go for that. I also did a change like that, and my life has never been the same. And I don't regret stepping away from a toxic environment. So come join us, UK, US, Canada, wherever. Be determined, pursue it, don't give up. Obstacles will hit you in the face. You deny
Definitely.
that visa, you fail that exams, but keep going at it. Don't give up. We are not here to drag you, we are not here to convince you. We are here to push you, as Gloria would say. So thank you very much for watching. Share this video with others. Subscribe to her channel. Please subscribe to my channel. Subscribe to our channels. We are doing this job. It's not easy. We still have a full-time family, full-time nursing job, and we still make time to tell you the reason why you should not give up on yourself. Thank you very
Yes.
much, Gloria. Any last word before we go? Sign off on my channel.
Thank you so much. In fact, I love your content. Like, they are beautiful. You don't know how long I've been following you. I actually did not know that we'll be doing this. So I'm honored to have you. And like I'll just say, YouTube is something, a way of life. It's actually like a way of life right now, and it's value. We're giving value, and well done for all you do. Thank you everyone for watching. These things, you are not paying for it, so just get as much knowledge as you can, and please go for your dream, pursue it, and don't rest until, in fact, don't rest. Like me, I don't rest. As I am now, I'm already researching and browsing other countries and other things I can do with my life, because life is too short. Live it and be happy. Enjoy the process as well. Enjoy the process, because it will become history one day. Enjoy the process, and good luck to everybody.
Aw, thank you very much. This has been so great. Thank you.